Hi, my name's Kelly. I am a CBT therapist and forensic psychologist. Today we are going to be looking at how to use behavioural experiments to help someone that we're working with or on ourselves to challenge our beliefs or our rules. So beliefs are really things that we believe about ourselves. It could be from maybe what someone else has said to us or an experience that we go through. Or if we're thinking about with rules, again, there are rules that we apply to ourselves, but they can sometimes develop from really early on, from childhood, from things that other people have said to us. And when we look at rules, they are often, we can know what they are because they could be a should statement or a must statement, a shouldn't or a mustn't. So should, must, mustn't, shouldn't. And it could be like, I must always work hard, or I shouldn't get bad grades, or kind of things that, and they could be obviously coming from someone else that is giving it to us. Or it could be that I must always wear makeup, which again, as a young person, probably wasn't told that much. But as an adult, that's become a rule that we have placed upon ourselves. But in CBT, we can do something about rules or beliefs. So I'm going to take you through how to use behavioural experiments. I've got another video on behavioural experiments on my page. So if you don't know what they are, check that one out first. So first of all, if we're thinking about what the kind of the belief that we are testing. So I'll give you an example. So working with someone who has just had a child or the kind of that there's been a change in their body for whatever reason. It doesn't have to be through having a child. So their belief is, I look so different to what I'd looked before. I look disgusting. So you get what that belief is for the individual. Then you get them to rate in a percentage how strong they believe that belief. So 100% being obviously they 100% believe it, all the way down to 0. Once you've got that and you've got that belief, and it may take some work to actually pull out what belief you're going to work on, then you want to get them to think of what an alternative could be. So something that's maybe a little more balanced. It doesn't have to be entirely positive because that may not sit with the person that you're working with. So an alternative could be that I look so different to what I did before, but that doesn't matter. So the belief, that first part, is that they look so different to what they did before because they may look different. It could be through age, it could be through an accident, it could just be through things changing and our bodies changing. But the first part they've decided to keep the same. So I look so different to what I did before, but it doesn't matter, and that's the key. So then once you've got that and you've got an alternative belief, and you may choose to then rate the alternative belief. So similarly how you rated the belief that you're trying to challenge, you could also get them to rate the alternative. So again, using the percentages. And then what you want to do with the person that you're working with, or as I said, you can try this out on yourself, is to plan an experiment. So think about what could be an experiment that could help them to work with this belief. It could be maybe something that they avoid because of that belief. So because they feel so disgusting that they don't look at themselves. Okay, so let's try a belief out by testing out that through an experiment. So an experiment could be standing in front of a mirror for 5-10 minutes. Whether you want them to do it with their clothes on or off is a completely different story, but whatever works for the client. So getting them to stand in front of a mirror. And then, okay, so that's the experiment. But what do you think? What do you predict will happen when you do that? So, for example, I'll sit there and feeling really cringy. I'll have loads of negative thoughts. I'll think about others' perceptions of me. Maybe I'll look away from the mirror and I won't be able to look at myself. Then how sure are you that this will happen? Again, percentages. They're your best friend with this. So 100% believe it's going to happen, definitely going to happen. And then we want to think about, is there anything that we need to be aware of in this experiment that could be seen as maybe a safety behaviour, or it could be something that is an avoidance behaviour that you need to make sure that that person or yourself is dropping during the experiment. So maybe covering their body, maybe making sure that they're standing at a certain angle, having certain lighting on, All things that may help them to feel more comfortable in the situation, but it's not helping to challenge the belief. So just to be mindful of that and to think about, are there any things that you need to think of and work with? And then once you've got that idea, then you want to say, okay, so what is the evidence that you will judge which belief is more likely to be true? And again, when we're thinking about this experiment, we're thinking about actually using evidence that are cognitive. So we're thinking about using the evidence as the thoughts. So it could be that the amount of thoughts that they have, or the amount of times that they say that they look disgusting, or the amount of times that they look away. And thinking about, okay, so how can we measure that? So maybe through a tally chart, or it could be through someone that they trust observing them. And it's about getting them to try this out and thinking about, there could be a whole range of evidence, and there could be a whole range of things that they may do to allow them to be in this experiment. But the key is making sure that they do it and get them to experience the feelings, the thoughts that go through their mind and their body. Then once you've done all that planning, you get the person to go and do it. So go and carry out the experiment. And then you can, obviously if you're doing it with yourself, check in with yourself. If you're doing it with the client, you want to just get them to reflect on what actually happened during the experiment. What did you notice? What happened? What didn't happen? And then you want to do the debrief. So with that, you want to re-rate the belief. So whatever you rated the beliefs at the beginning, so if you did the belief that they want to change or their alternative belief, get them to re-rate that percentage. Then how did that happen? How did that fit in with your original prediction? And then re-rate the prediction and see if there's any conclusions that they can come from the experiment. And you can do this again, you can get them to repeat it, or you may want to continue to build on it, to add different things. Stand in the mirror longer, maybe wear less clothes, standing in a mirror when you're outside. So it can really be adapted for the client and continue to progress. Sometimes you do just do it once because you want to try and test out those predictions and it could lead on to something else. Whereas for other people, it may be that repetition. So I hope that helped to explain how you can use behavioural experiments to challenge those beliefs and rules an individual may have. Please like and subscribe and check out my other videos. Thank you.